Hello, everyone, and happy Tuesday. You guys are here in the right place at the Healthcare Supply Chain Hub. I am Angelique Beslick, and it's so good to see you guys on our weekly Learning Bites, where we take 30 minutes of your time every Tuesday and talk about hot healthcare supply chain topics. So I'm so glad that you guys are here, and let's get this rocking and rolling because I can't wait to see what the topic is for today. All right, so I wanted to kind of review this as we've been on this little journey here since January. We've been talking a lot about supplies and services decision making, governance, what happens once an approval is done, execution afterwards, trying to get people to stop stalling in decision making. We've been like on this little journey all about supplies and services decision making. And I'm really excited today because I want to review the approval trap today and thinking about just overall why alignment feels productive. But then when execution is supposed to happen after an approval, it never shows up. And really, why healthcare decisions die after a yes. Now, I will admit, there's many times we can't even get to a yes, or we can't even get to a decision of yes or no. And that's a whole nother learning bite that I had done. But once it gets to a yes, thinking about this whole execution never showing up and why some of that happens. Okay. So, some key takeaways and thoughts for today that I wanted to share with all of you is approval does not equal execution in healthcare. And we talked about this a little bit last week in the Learning Byte, but when you think about this, I got something approved. That doesn't mean it's going to be executed. Have you even thought about, do you need a project manager to implement it? Do you need IS or IT? Do you need biomed or clinical engineering? All these things could stall something from execution because you don't have the resources or the capacity, or there could be many other reasons, right? I have gone through initiatives where we've spent 8 months trying to sell something and an idea to the SVP team. They finally say yes, and the physician leaves. How many times have you had that happen, right? So there's many reasons why this could happen. Governance is optimized for decision making, not delivery. How many of you guys out there have a system and a governance process for the delivery and implementation of something? A lot of times we just have a charter or governance over supplies and services decision making or value analysis, not truly then the implementation and the delivery of something and how things happen after a vote is taken. And then most supply chain failures are structural, not personal. We always keep talking about this whole, I always blame it on Skippy because it's always his fault. He's the conversion coordinator. Or I always blame it on IS or IT or even just like a group, right? They always make everything fail at my organization. That's not true. Usually there's a structural or a process or a communication issue going on there, right? Savings don't disappear. I've seen a lot of times where they just stall after the meeting. And any of the benefits where you voted yes for that product or that equipment or that technology, the savings don't disappear, right? We still need to implement. They just sometimes stall. And I've even seen it where people are doing a conversion and they forgot a whole hospital, or they forgot the non acute clinics, or they forgot a whole unit in one of the hospitals to convert to something. And all of a sudden you're like, why is there missed opportunity? Something's happening at this site. I don't understand what's going on with the savings. And repeating initiatives are a signal, not a coincidence. So if you're doing an initiative over and over and over again, it's a signal. It's because you probably didn't do it right the first time, or the second time, or the third time. And this pattern cannot be fixed with just awareness or templates or webinars or Angelique just talking about it, right? Execution requires training leaders differently, not motivating them harder. So that's really what we're going to kind of get into today. Okay, so healthcare makes more decisions than almost any industry. If you think about how many SKUs, product categories, all the things that we have out there, there's way too many. This is not buying potato chips for aisle 17 at Target. This is not buying, some kind of quarter panel for a Ford F-150 truck, right? We have a lot of complexity in healthcare and what we purchase, whether it's a purchase service, a technology, a piece of equipment, a supply, and then it touches so many different specialties, right? And even in your corporate office, you've got things that are being purchased, whether it's consulting or a technology or an application or a system or something, right? Or a subscription even. All those things are a lot. That's a lot of decision making. And most initiatives are approved, applauded, and then quietly abandoned. I've seen that happen so many times. There's a lot of times where I'll tell my team, you're not starting an initiative until I know 100% that it's funded and we have budget. How many times have you done an RFP out there and you went through the whole motions for 12 months and then it was never funded? Quietly abandoned. And thank you, supply chain, for spending all your man hours for 12 months on that amazing initiative. So, this session really names why that pattern exists for all of us in healthcare supply chain. And poor vendors and suppliers being ghosted, right? After they did all this work replying to an RFP. Healthcare doesn't lack decisions. Budgets may be approved every year, right? And they usually are for something, right? Contracts are signed and stored every year. Committees reach consensus regularly. We're not lacking decisions from happening. Money is being spent. Contracts are being signed, right? That is the truth. But it lacks follow through, right? Execution is just assumed, not designed. How many times have you guys gone out for RFP and a decision was made, you got the budget, and then the project team just assumes execution is going to happen? And who do they assume is going to do it? Supply chain. And then it's not designed. Oh my goodness, we bought a fleet of fetal monitors, or we bought a fleet of pharmacy cabinets from Omnicell. The assumption is somebody's executing that and making sure that conversion happens and construction's happening, right? Approval is treated as the finish line in the majority of initiatives, unless you've got some kind of governance around execution. And then work begins after that governance exits the door. And I see that happen all the time. I think that approval is not execution in any way. And if there's a health system out there that feels that, or even a vendor, supplier, distributor, GPO, we're wrong. Agreement does not move work. Alignment does not change workflows. Votes do not assign accountability from a value analysis standpoint. I've had vendors that have said, "Well, it's approved to use at your organization." That does not mean that it was added to our item master. The old was pulled off the shelf and then your stuff is put on the shelf. That doesn't mean execution happened, doesn't mean that the conversion happened, doesn't mean IS or IT has time to implement your new software, right? And there's all these assumptions happening from all the parties involved saying, contract's fully executed, the signatures have dried on the paper. That doesn't mean anything. It does not assign accountability of who's doing what next. And the assumption always is that supply chain is the person that's accountable, right? Governance ends where the work begins. So if you think about committees are optimized to decide, not deliver. When have you seen a value analysis committee out there other than voting for things? Are they also then sitting there and deciding how implementation is going to happen? Usually not. Hey, if your CBA committee is set up that way, I really, really commend you. Once approval happens, ownership kind of dissolves, right? Because you've got this champion, this executive sponsor. They're really pushing, pushing, pushing for it to get approved. And then whatever happens to that executive sponsor, like they ghost you, right? And execution really lives outside of that room where that governance happened, where that decision happened, where the committee met and voted. And no one owns really what happens next. So there's no named execution owner. Do we believe that it's going to be that same executive sponsor? Well, it should be, but that person's already moved on to trying to sell their next biggest thing they're trying to get for your health system. Timelines are implied, not assigned. So the ink is dried on the contract. The assumption or the timeline that is implied that, well, I would assume it's being implemented this week. That's not assigned. Oh, and by the way, did you know that IS or IT has a backlog of 18 months before they can implement your software? That happens all the time, right? Risk quietly transfers to operations because now they're like, well, that was voted yes. Where is it? And I need to start using it for our patients tomorrow. What happened, right? That is always what happens. And then what do? They look at supply chain. Supply chain absorbs that failure. Supply chain compensates to keep things moving. They'll send a million emails around saying, who's doing this? Who's doing this? Vendor, hold bay. Hey, everybody, just let's try to have another meeting. Maybe we need to meet again. They're flustered and they're like, nobody told me what was happening next. All I was supposed to do was get the contract fully executed. And execution gaps become very visible once operations start screaming, right? And the system appears functional while failing. We have a system, we voted, something got approved, there's a system, it appears functional, but it's really failing quietly at the execution stage, right? And then savings stall after the meeting. So savings are approved on paper. Everyone's excited. We can get savings. But if the workflow doesn't change, financial impact never materializes. If I don't have the resources, the capacity to do that conversion, and a lot of times this doesn't happen converting a widget to a widget. Okay. We're really talking about the big stuff here, usually equipment, construction, purchase services, a lot of big things, maybe large conversions too. Supply chain is the one owning small commodity type of conversions. They're going to get that done. This is where the big stuff is, right? And then clinician trust is very, very difficult for supply chain to gain. And in this type of process, it will erode quietly, right? Clinicians hear about approved changes, they're excited, they're telling all their patients, and months pass without visible movement. Boom, your credibility erodes. And they're like, well, yeah, there's this new product introduction process, but that's a black hole. I mean, it got approved, but then I don't know what's going on afterwards. And they just lose trust. And who do they blame? Supply chain. We're the failure, right? Because all of a sudden we're not getting all these folks on board to make it happen. ISIT, clinical engineering, facilities, whoever needs to be involved, construction. And that ends up being supply chain's problem because a clinician only thinks, I asked for something, I presented and I got it approved in a value analysis committee. And then what? Supply chain, what are you doing? Where is it? It was supposed to be delivered on the dock. Okay, yes, we got this huge piece of equipment delivered, and now what? I don't have construction or clinical engineering or facilities to help install it. Nobody knows what's happening, right? And then the same initiatives return every year because stalled work is then rebranded as something. New committees revisit old decisions and the cycle repeats. And you're like, gosh, I see it in Lumiere. It was approved last year. Why are we revoting this? Well, because it never implemented. Well, that's a different problem. That's a totally different problem. It shouldn't have to go through Lumiere and a value analysis committee to get revoted on. Well, maybe some of the benefits that we thought about back then when we voted for it have changed, and you should do a look back, of course, 6 or 12 months down the road to make sure you got all those benefits. But if you never implemented it in the first place, there's nothing. And this keeps happening by design. This is not a people problem. This is a structural design flaw. There's no procedures here. There's no charter. There's no governance over implementation. Healthcare trains decision making, not execution. And I will say it again, if your value analysis committee or your executive steering committee over decision making has an amazing implementation process or charter after decisions are made, wow, you're steps ahead. But if you don't, obviously you need help building it. That's where I'm here training everybody to do these things. It's super important to have it. And there's many companies out there that have done lots and lots and lots of strategy around selling something. But usually even vendors or distributors or GPOs, they're like, well, we can't implement this for you. You have to commit internal resources and capacity to implement this. We were here on the sales side, but I can't install that piece of equipment without your construction team, your facilities team, your clinical engineering team. Or they can't come in and integrate that with our EMR or with our ERP system. They're like, you guys have to do that. We just sold it to you. Now you have to figure it out, right? Integration, implementation. And I feel bad as a provider for those suppliers that had done all this work and gotten all these people excited, and everyone thinks they're getting this great new technology and it can't go anywhere, right? And I want to make sure that why a webinar can't fix this. Like Angelique sitting here in this 30 minutes teaching you how to redesign everything. I'm giving you guys awareness. That does not redesign your operating model. You guys have got to get out there and learn how to redesign your operating model and figure out how you're going to fix this. I'm trying to bring it to light to all the teams out there that this needs to be done. Templates do not assign authority. You've got to work on that internally within your organization. And motivation, I will motivate you guys all day long. That's what I do. But that does not replace the structure. And you guys have to figure this out within your organization on your own. I'm just here to teach you how to do it. And that's what my program does. Okay. Execution really is a discipline. It's not instinctive. Your teams may understand decision making within your supply chain team. They may understand a conversion and executing on a conversion because that is what supply chain knows. But supply chain is not a bunch, your contract administrators or your sourcing team is not a bunch of project managers. Okay. Execution is not instinctive to them on, okay, the ink is dried on the paper, go execute. That's not their wheelhouse. They're there to source, negotiate, get a contract fully executed, and say, clinician, you got your thing. Those things must be trained intentionally. And I'm hoping you all have a project management office to help with large projects like that. Healthcare rarely trains this, though. And that is why I am doing lots of training out there for everybody, because I want to make sure everyone is trained in all these things. This is a training problem. I do see lots of leaders being promoted for decisions. I see physicians, I see clinicians, I see leaders and VPs being put on committees to help decide. and vote. Yes or no? I do not see leaders being promoted for delivery, implementation, execution of initiatives. I don't see that happening. I see way too many decision makers out there. I don't see a lot of implementers and executors. And isn't healthcare just literally riddled with a lot of decisions have been made, but then they go nowhere, not just in supplies and services decision making, but in strategic vision? Are we really good in healthcare at execution of our promises? Our promise as a health system is we're going to increase our reimbursement in these 10 areas, or we're going to reduce length of stay in this service line, clinical operational service line, or we're going to focus this year on our throughput. How many times do we see excellent, amazing execution of those things? I see a lot of leaders promoted to make those decisions, but not to implement. The same goes with supplies and services decision making. And that gap compounds over time and it just gets worse. And then supply chain is rebranded to this black hole once again. And I see tons of solutions on the market for decision making, new product service request portals, and all these ways that physicians and clinicians can insert their ideas. And then they organize the ideas and then they vote the ideas. But I never, ever really see solutions out there on delivering on those final voted items, whether it's a service or a piece of equipment or a huge software implementation. There's a lot of gaps in that. I will give you an example. Huge ERP RFP done, right, at a health system. And we put all this effort at doing an RFP. The vendor showed up. It was amazing. The presentations were over the top, selling just this most amazing thing. Okay, we did an award. And then what? It comes time to implement the new software. How many times have we seen ERP implementations fail over and over and over again for many different reasons in HR, finance, supply chain, all the pillars that software supports? I thought you promised during the sales strategy that there was going to be so many new enhancements for finance or for supply chain. I thought there was all these new capabilities for users on the HR side. What happened to that? Oh, we got apples to apples. Huh. Wow. Oh, we are an early adopter. You've never implemented that before. Wow. How many times have we heard that, right? Those gaps compound over time because no one is anybody great in the project management and implementation and holding the parties accountable to the contract terms that were sold in this grandiose behavior, and it never happened, right? Training is the problem. Do we train our healthcare staff at our health systems on proper project management, how to lean into an initiative, how to upgrade or implement an ERP system very well? Our poor IS teams, our poor finance, supply chain, and HR teams, are they experts in implementing an ERP system? I don't know. I don't think so, usually. I wasn't trained that in college. So these are all the things. This is all part of training, right? And I want to make sure that I'm out there training all of you guys in these things. So some hot final thoughts. Some problems require training, not awareness. This pattern cannot be solved publicly. It can't just be a 1 hour webinar or an Angelique's Learning Byte, or I'm going to a conference. I'm going to learn how to implement an ERP software. No, I've never seen that happen. It requires professional training. And this is where the conversation really, really ends, right? Because that's where the problem is. Are our teams being trained well enough to go implement and execute on these amazing, amazing initiatives we're working on in supply chain? So I want to go deeper in the conversation. I want you guys to get certified. It is time for you guys to get certified. Start your training journey now. I always give out my cell phone number. I always give out my email address and my website. I want you guys to reach out to me because it's time for those folks in healthcare supply chain to get trained. And that's what I'm here for. And we all know there's a lot of brokenness and complexity in healthcare supply chain, but I want to be that person to be there to help you through it because that's my job. So awesome to see all you guys. I hope you have a great rest of your day. I'm sure as I was sharing stories today, you're relating, going, yes, that's true, Angelique. But until next Tuesday, I will see you, and I'm hoping I gave you guys a whole lot of things to think about today. Have a great rest of your day, and we'll see you guys next week. Take care.